You think nicotine causes the cancer? No, it's not the nicotine. Cancer can be treated, but you have to come forward to know about it, to get diagnosed and to get treated. Today, many people don't know about cancer because no one wants to know about it. There are few characteristics which defies cancer. Your normal cells in the body can grow in many ways. Can either grow in size, that is called hypertrophy, and there is something the normal cells can increase in size. It is called hyperplasia. How cancer treatments are tailored? No, it is derived from three factors: the stage of the patient, the histology of the patient, and something called the molecular profile also.
Welcome, Dr. Yesmin. This is something I've been planning for a very long time, and I've been hoping you'd get time to come here to the studio today and have this chat with me. Today I want to talk about that big bad wolf per se, as everybody talks about and is fearful about, and that's cancer. So Dr. Yesmin Nureja, please introduce yourself first.
I'm Dr. Yesmin Nureja. I'm a radiation oncologist and I am associated with Apollo Cancer Center now. First of all, thank you so much, Rashmi, for this talk. I was also looking forward because if we live in a society where people doesn't want to talk about cancer. This is something people really want to avoid.
Doctor, to start with, everybody feels that if they get cancer, that is the end of life. There's a huge fear around it, and so much of highlighting happens. If some celebrity gets cancer, everybody's talking about it and everybody's fearful about it. So, is that true? Is cancer such a difficult condition?
Cancer per se is a difficult entity for us also, for the doctors to challenge. But then let me tell you one thing. Cancer is treatable, cancer is curable, and cancer can be managed when the diagnosis is quite early. So it's not like we don't have facilities or we don't have centers or we don't have, many people have this misconception that, cancer means there is no treatment. That is not the factor actually. Cancer can be treated, but the thing is, you have to come forward to know about it, to get diagnosed and to get treated.
So why are people not able to diagnose cancer early? What are the signs they miss?
The thing is, the acceptance is very less. Today, many people don't know about cancer because no one wants to know about it. How many of us know what are the signs and symptoms of cancer? Many people doesn't know, only few know. Now the thing is, we are living in an era where either people avoids it or people are kind of over information, which both sides, if you say, which is not very good. There are people who don't want to know about cancer. If let's say I'm telling in a very easy way, oral cavity cancer something is very common in India because of tobacco usage, the prevalence of tobacco usage in our society. Now what happens if you get a wound in your mouth because of chewing tobacco and you are avoiding it? At some point this might be a cancer, but you think if you go to a cancer doctor or someone, why to fall in that trap? Awareness from both diagnostic perspective and the awareness from that oncologist perspective that I have this, should I go to an oncologist? Most of the time what people do is they'll go from one doctor to another doctor. Some people are there who may repeat medicines upon medicines until it progresses and it comes a very advanced stage. Then only they will go and they will give a preference to go to a proper oncologist for the treatment.
Actually, I notice this trend in general itself, even for wellness, because I meet so many people who talk about health all the time saying, I feel tired, I feel this, but nobody wants to do anything about it. Nobody wants a diagnosis, nobody wants an answer. They just go to people who give them an answer that they want to hear to convince themselves that they are right.
Yes. Which
is
true.
So strange. I mean, why would you want to do that to yourself?
That is a very correct thing you told. People like to hear what they want to hear. And that is the one problem that many people kinds of get delayed in the treatment.
Is this the reason why there's a sudden explosion of cancer cases that everybody now is talking about cancer? Or am I wrong that suddenly everybody is getting cancer? Or what is happening? I hear about cancer all the time now.
Yeah, nowadays you can hear lots of people talking about cancer or many people within your vicinity who are getting diagnosed with cancer. Now for this I would like to say one thing is, it's not like this 10 years from now people didn't have cancer or 100 years ago people were not diagnosed with cancer. One is the prevalence of few cancer has arisen a lot because of again habitual factors and all. But then one thing if you see nowadays, we have lots of diagnostic facilities available. No, people, as I told, because of internet or any other thing, they're becoming over informed. So many people, the diagnosis is getting more and more. One is, yes, the awareness is kind of people know it might be a cancer, and the second thing is, we have lots of diagnostic facilities and centers also available to get it diagnosed faster.
Doctor, if people are doing annual health checkup, okay, regularly after say the age of 30 or 40, or if somebody is a regular smoker or a drinker and they are going through this annual regular checkups, is that enough to catch cancer early? Like, how do you catch cancer early?
Diagnosis of cancer as early as possible. So there is something called screening. Okay, you can start the screening as early as possible.
Why would you screen for cancer? Like, why would a normal person ask to screen for cancer?
You know, one thing I'll tell you. Okay, normal person means out of all the cancers, do you think cancer happens because someone in the family had, or hereditary purpose? Like, you know, someone in the family had, I may have. Someone, like a normal person cannot have cancer. You can give the explanation like that, because let me tell you one thing. Out of all the cancer, the one which happened because of familial causes is on hereditary is only 5%, 5 to 10%.
And which kind of cancer is that?
Your breast cancer could be one. Breast and ovarian cancer could be one. And you know, even lung cancer, prostate cancer, and all those. Other than this, even in breast cancer, Rashmi, the hereditary factor is only 5 to 10%. 85% or 80% of the breast cancer you see in the clinics are sporadic. They may not have any relative or anyone in the family who had breast cancer.
A few years back, there was this news about Angelina Jolie removing her breast
Yes.
because her aunt and her mother passed away with breast
Yes.
cancer. I hope I'm factually correct. At that time, I was very shocked. So I was thinking whether that's the right thing. There was a lot of debate and conversation. It's right, wrong. But is that a real thing? Can such a thing happen? Then she was justified to do that.
Yes, you can. Actually, in the West, people are more aware and they are more factually right, I would say. Because there is something called HBOC, or which you tell as hereditary breast and ovarian.
And you can identify that?
Yes, you can identify. Yes, there are few tests in which you can identify, because there are some pathological variants. There are some genes associated with that. And if you get those identified, you can do what she did is a prophylactic mastectomy and oophorectomy, which can be done.
So, doctor, what are the types of cancers which are really more prevalent today?
Cancer can arise from any cell, any tissues. If you see in the very basis of origin of cells, every cells in the body, like the tissues, it can be divided into epithelial cell and something called mesenchymal cells. Now the thing, epithelial cells means your skin, hollow organs and all. Okay, so those things give rise to something called carcinoma. Now there is mesenchymal cells like your connective tissue, blood, muscles and all. From that there's something that arises called sarcoma. Now every organs in the body can have its own type of carcinoma. From a layman perspective, if you have to explain to someone, from lung there can be adenocarcinoma, the most common which we see. Then there can be something called squamous cell carcinoma. Then coming to breast, in breast cancer also different type of cancers can, in the carcinoma range, different type can happen, and there is many molecular variation within that cancer also, based on which only the treatment varies. Let's say if 3 females I meet today and 3 females have breast cancer, each can have their own molecular profile which are different, and that will identify their treatment.
There's no breast cancer ke liye this treatment. That's no specific.
No, there is actually based on stage. See how cancer treatments are tailored. No, it is derived from 3 factors: the stage of the patient, and the histology of the patient, and something called the molecular profile also. Now the stage of the patient will tell you like how to tackle it. Is it an early stage or it is an advanced stage? Now with molecular profiling and all, it will help the patient to get extra benefits of either hormonal therapy or targeted therapy. So every patient, every individual has their own personalized treatment based on their stage, based on their histology, and based on their molecular profiling. Even in lung, it is happening, even in brain tumors.
Doctor, why did you get into this field of cancer? Why did you choose this?
The reason behind why I joined oncology is quite special. Actually, my father was diagnosed with cancer. He is a cancer survivor. By God's grace, he is still with us. He is doing fine. So my father was diagnosed with cancer when I was very small. I don't remember. It was around 1993, 1994. So I didn't join school that time. So I saw my father struggle at that time, being a cancer survivor, what he had to go through, So that kind of, my father motivated to me, myself to be in this field. He felt at that time, initially, like that time, around 1993, 1994, as I told, the awareness of cancer was very less. And basically in our part of India where I come from, it is even less. So that time my father was managed as a TB case for quite a long time. After that, someone in the family, after 6 months only came and told like, okay, this might be cancer. So why don't you get treated? So So initially there was lots of misconception where to go, how to go. Finally he landed up in a cancer center here in Tamil Nadu and he got treated. And in that time my father was mentally very low, and those doctors whom he met at that time, and there are very few oncologists that time to be around, and right now we have social media and all, that time we didn't have, so people were not aware of many good doctors. So there were few doctors who motivated my father, and that time my father made the mind that if ever I had to make my daughter something, I would like her to be a doctor, especially to be in the oncology field.
That's a very inspiring story. And I mean, the journey couldn't have been easy. Just to pursue a choice of career in life for your father is it's a really big thing, I think.
Actually, more than me living this, I think I'm living my father's dream, to be very honest. And while I was growing, I just did medicine, then I came to this field. And this was my always the first choice.
Doctor, today you meet a lot of patients who are, you treat. You chose this field in your life because of your own personal journey with your father. What would be the one big mistake or a chronic problem that you observe around patients who are diagnosed with various stages of cancer?
I think I'll tell you one very good thing about here, being in Tamil Nadu and Chennai is, patient have this concept of oncology. Now, oncology is a field, I feel being in medicine MBBS also, even the medical student doesn't have much knowledge about oncology, okay? But here in Tamil Nadu, especially Chennai, the people, irrespective of the class and background, they have that knowledge, or they know where to go if they suspect what. Unlike where I come from, back in Assam, we don't have that oncology concept much. People likes to go from one doctor to another doctor because they want to hear what you hear, as you earlier you told, no? So they don't want to hear that this is cancer. So they want to go from one doctor to another doctor who might, tell them, oh, this may not be cancer. And by that, they lose so much time because cancer doesn't wait, the cell rapidly grows. So that is quite less here. So one thing that is a bonus among the patients here, I don't have to face much challenges here because the person who comes here, once you explain them, they kind of accept that.
So there's a need today for creating awareness.
Definitely,
and
Rashmi.
creating a openness around the conversation. But do you think the family plays a very big part here in removing the stigma that the patient might feel? What is the reason why people are so scared to talk about their condition?
See, Rashmi, what happens now? We live in a society where people thinks there are people like who comes from outside, because Chennai has a cancer patient population of both, where population who comes to Chennai from all over world, over India.
Tamil Nadu, I think, is like medical tourism capital, right? And Cancer Institute Adyar has people from all over India. I think a lot of people come here and stay for a particular period of time just to get cancer treatment.
Yes, all over Chennai, there is a very mixed population, but it differs to hospital from hospital. Like in the government sectors, the population of local population patients more than in the corporate sectors. Now, since I am associated with the corporate sector hospital, Apollo, which has its name on its own, so now the population in Apollo is mixed. We have both Tamil population and we have both outside population. Now, one thing good about our Tamil people is, here you have to explain the patient once or twice. The first time they come to OP, you explain them the diagnosis. By the time the diagnosis is done, they come, they have that acceptance to go ahead. Okay? And in that matter, see, the decision can be taken by the patient alone. The family has to be with them, okay? And one thing here I have seen is, the team, it's always a teamwork, okay? I feel cancer treatment is always a teamwork. It's not only the, like patient is cured and you can just add the feather to the cap of the doctor. It is always the family. Because we were talking so much about cancer earlier also. So what happens here is patient accepts that, okay? And the family had to be there with the patient. Okay? It is not only emotionally. The family and the patient has to go through from every aspect. Emotionally, they have to go through financially. And in that, I think the family plays really a very big part for completion of the treatment, because cancer treatment is not something of 1 day or 2 days. It is a commitment of few months. So from here perspective, when I'm talking about the patients here, it is quite easy. And when I'm talking from patients from my side, one thing I have seen is our side patients, there is quite naive in this field. Their acceptance is little low. So whenever I see a patient who are coming from my side or West Bengal or Bangladesh or wherever, they have this. Even coming here, I have seen many going through doctor shopping. Sometimes the patients kind of accept that I may have this, let's go. But it's the family who will, no, will take opinion upon opinion. And I think that matters a lot.
But doctor, do you think that attitude stems from the fact that there is a social stigma? Like, people feel like how you have communicable diseases, right? Well, like, agar you have cold, then the other person will get cold from you. Do you think that is a social stigma where you feel if you have
That's
cancer?
what I was telling, no? Like, even I have seen patients, not here only, I think in rural segment patients I have seen who will ask this question. In urban population, very hardly I hear this question that someone will ask, oh, my wife have cancer, will I get? But in our side, I have seen many people doesn't like to share their diagnosis. They go through this silently in pain, okay? In a silent pain, because they think if they tell to everyone, share the diagnosis to everyone, they might be treated as someone different. Because there are some, still not many people who feels like, cancer is communicable. There are. Like, I had one patient in OPD where, the wife, last 2 months ago, I saw them in Assam. The wife was, she was very much used to soaps and antiseptics in her hand, because she thought the plate in which the husband is eating, she have to clean it more, because in the same plate, if anybody else eat, the germs might travel in the family of the cancer, which is wrong. Cancer doesn't spread by touching or eating or wearing the same dress. It's not a communicable disease per se like that. Like,
you said only 5% of the cancer is hereditary, right? What are the various factors in today's world that we are exposed to apart from tobacco, which is like causing a rise in cancer?
Cancer is nothing, but this is not some alien or something had come in the body, okay? Cancer is the normal cells in the body. Our body is made up of different organs, okay? And different organs has its own tissue, and every tissue has its own cells, right? So every cell in the body, it has its birth and it has death. That's how we grow, because the cell multiplies, right? So there are some cells in the body who denies to die. One cell will regenerate, then another will die, okay? But the cancer cell doesn't die. It rapidly multiplies and it grows into a tumor. And at some time, if it keeps on growing, spread to one part of the body to another. Now the thing is, your lung tissue, everything in the body is beautifully placed and beautifully engineered, right? Your liver stays in your place, your lung is in your place, your heart is in your place, right? But what happens if a cancer cell, it arises in the breast, over a time it is not taken care of, it may spread to the lung, it may even go to the brain.
But doctor, see, for example, I have fibroid, which is also a growth which shouldn't be there, no? So does every tumor or every growth is a cancer, or like what?
No, there is few characteristics which defies cancer. Your normal cells in the body can grow in many ways. One is like it can either grow in size, okay, that is called hypertrophy, and there is something, the normal cells can increase in size, it is called hyperplasia. That is means it has just increased in size, but it's the normal cells, okay, in the body. But beyond that, sometimes what happen, like how you asked me earlier, like how cancer happens, okay? So when the normal cells go through something repeatedly, injuries or something, it goes into dysplasia. That means the characteristics are little different from a normal cells. Then it goes to metaplasia. Like what happens, it changes the characteristic of the normal cell to something else. Then it goes into neoplastic changes like cancer changes. Okay. Now tumor can be two types. Either it can be benign or it can be malignant. Like malignancy is cancer. Okay. So that what differs a normal cells or any normal lump or tumor or a benign tumor is your cancer cell, it can travel and it can metastasize. In medical language we tell metastasis. It can spread from one part to another.
So you're saying that if there is an injury or a small problem in any organ of your body, it can be skin or stomach or anywhere, that constant irritation of that wound or the not allowing a part of your body to heal can lead to cancer?
See, it is like this, Rashmi. Not every part of the body. Now you tell me one thing. We know tobacco causes cancer, right? Like that is like well established, and it attributes to 20 to 30% of the cancer. Now, when we eat tobacco, we chew betel nuts. It's pan and all very common in North India, or that khani they use in. Now, do you think that nicotine? Because what is the addictive factor there? It's nicotine. Yeah. You think nicotine causes the cancer? No, it's not the nicotine. So what causes the cancer is when you put that pan or that canny in your mouth, no, that layer of the skin goes through engineering. And the good thing about the body, how it is engineered, it can, replenish on its own. It can regenerate in its own, no. But there is a time where the body also gives up, because repeatedly that injury is coming in the mouth, then only the cancer happens. In the same time, in the esophagus, the food pipe also, if there are some causes of cancer, right, like it can be a viral cause, it can be addictive cause, or it can be like over acidity or something, it goes on with the injury. And if you are someone who have that gene makes you more prevalent to that cancer, you may develop. Now there is this very good line by Dr. Francis Collins, who told that cancer is like, your genetics, it's like a pistol. Okay, your genetic loaded the gun, and the environmental and your habitual factors kind of pull the triggers. You got it?
Yes.
So you may have been loaded with some gene which makes you more, to develop cancer, more prone to develop cancer. And top of it, you are adding factors like you get some viral infection from the environment. You are using some, things which are associated, habitual things which are associated with cancer, or you're exposed to some kind of medicines that makes you more prone to develop it.
So you're saying even the cosmetics we use can cause cancer?
See, Rashmi, always what matters is how often it has been used. So it is a very
Like I use sunscreen every day, or
see, now I don't know. It is difficult to comment on it, but what I'll tell is there was a time in older times, okay, then I think in the Victorian period and all, where people used to use lead in the face.
Yeah.
So lead per se, yes, it causes cancer. Now how you use it, how much chemical is there, but I don't think so, because that much prevalence is there, because everyone of us nowadays, everybody uses a small or little amount of.
Are there any specific chemical compositions on general products which are in the market, cosmetic products, that can be avoided? Like you have sulfate free, paraben free. Is it better to use those kind of products from the perspective of skin cancer?
See, it's always good to take care of your skin, Rashmi, but correlating makeup or something with developing cancer, not much of, ideal to say, I'll tell. Because, when I talk about, the hygiene with makeup may matter, the, brush and all, whatever you, but to correlate makeup and cancer, it is quite difficult. But it is always good to take care of your skin.
Doctor, if there's one advice that you want to give any patient who's going for cancer treatment or their family, what would be that one thing you really want everybody to know?
See, one thing I would like to tell the family is, first of all, persistence, acceptance. First is acceptance, I would say, that you have to accept, yes, this is cancer. And it is always good to go for, cancer has occurred, you should know where to go, okay, which doctor to approach, okay. Secondly, after that, you have to stick to your treatment plan. Okay, once you verify, okay, this is the standard treatment guidelines for this cancer and I have to go through it. Okay, now what I would say is, acceptance is there also nowadays, because people are educated, the education level is going very high. But the thing is, nowadays, since we have so many cancer facilities and everything available, people kind of has gone in the mindset of doctor shopping, because every few kilometers nowadays you will get a cancer center, right? So there is a certain subset of population who would like to go for doctor shopping, then that delays your time. And then once, okay, you are satisfied with one of the doctor and you go for the treatment, okay, what happens is that persistence, as I told, cancer treatment is not something, it is 1 day or 2 day treatment. It is a few weeks, few months, maybe couple of years also.
So
sometime.
What you're saying is, cancer itself is not a problem today. It is the mindset of people which is a bigger problem than the cancer.
Yes.
Okay, that's very unfortunate. Yes. I mean, it's something so treatable and manageable, and people lose the opportunity to live a good quality life.
Majority of the cancer are curable and treatable. There are some cancers which are very difficult, I would say, but there are facilities available.
And after going through this treatment of cancer, for any cancer, can a person go back to their normal, the pre-cancer diagnosis kind of a way of life? Or how does life change for them?
As I told, cancer is curable when detected early. In many cases, until it's like a patient comes in a very, in a stage where, we can just control the disease or we can offer a treatment, but it's not curable. Those who can be cured, for them I would say it's just stay. It's not the end of life. It's just a turn, okay? But after that, it's up to you how you choose. Because after that, also many things in cancer registry. There are few things like you have to be in regular follow-up. Unfortunate things again is people once they get treated, many people lost a follow-up with the patient, like with the doctor. Most of the patient, they lost the follow-up because they think, okay, I'm fine. But there is one catch in this is you in the first initial 3 years you have to be on regular follow-up, at least 3 monthly for the first year or second year, and if you can do that 3 monthly, at least every 6 monthly. Now why is that? Because even though cancer is treated, there is a chance of recurrence always.
That's because anybody can get cancer anytime. So
Yes.
whether it's a cancer patient who's cured or a normal person.
That can. So that to prevent that recurrence, or even to get that next recurrence if it happens in a very early stage or at the earliest, so we ask the patient. Many patients they comply, but there is some patients doesn't comply to it.
So this follow-up after a cancer treatment, is there a cutoff limit that after 5 years at least you can be like no need to go?
Yes, actually for most of the cancers, 5 years. First 3 years, every 3 months, or first 2 years every 3 months, then 6 months, then yearly you can go. Then in cancer also, whenever we talk about overall survival, okay, when we talk about cancer, cured, we'll take the 5 years, okay. So if we presume if first 5 years nothing happened to the patient, so we assume them to be cured. So the benchmark is 5 years.